Care Clinic in Midtown Little Rock to share with us some important information that could keep you off the list of 1,500 colon cancer patients that are added to that each and every year. Is that nationwide, or that can't be just Arkansas? That's nationwide, right?
No, that's Arkansas.
That's just Arkansas alone.
Yes.
So what is colon cancer?
Well, so colon cancer starts off as a growth in the inside lining of your colon. And over time, this growth enlarges and can spread to other parts of your body too, and that is known as metastatic colon cancer. And it often starts off as a polyp inside your colon and then grows from there.
So early detection is key to prevent that from happening?
Oh, yes, for sure.
All right, what are some of the symptoms somebody might experience, the normal symptoms of colon cancer?
Well, unfortunately, there are no symptoms specific to colon cancer. That's why screenings are so important. But colon cancer grows quickly, and it sucks up a lot of energy. So the most common symptoms include fatigue and weight loss, and sometimes they tend to bleed as well, so there can be some blood in your stools too.
And what are some of the risk factors that may increase your chance of getting colon cancer?
Unfortunately, all of us have some risk factors to colon cancer. Risk factors include smoking, physical inactivity, that's something that we all tend to have, obesity, diabetes, other diseases like Crohn's or ulcerative colitis, and there's a genetic component to it as well, so it does tend to run in families.
So if there's a genetic component to it, you're telling me that screenings for colonoscopies, you should start around 50?
Yes. Well,
but okay, go ahead, I'm sorry.
Well, so normally, if we do not have any family history of colon cancer, we would start at age 50, and we would need a colonoscopy every 10 years. But if there is someone in our family with colon cancer, we want to start 10 years earlier at age 40, or 10 years before our relative with colon cancer was diagnosed, whichever comes first, so we can catch it early.
So obviously groups that are more prone to colon cancer, one would be those who have a family history of it. Are there any other individual groups that may be more prone to colon cancer?
Well, unfortunately, the African American population, the colon cancer deaths tend to be more with them and less in Hispanics, and this could be due to either lifestyle or even genetics.
Okay. And how do you get screened for colon cancer? We're talking about colonoscopies. Is that the only way?
Well, it's not the only way, but it is the recommended way. Now, a colonoscopy is a visual examination of the inside of your colon using a long, flexible tube with a camera and a light at the end, and they visually examine your colon. And this is capable of taking biopsies or taking samples of areas which are abnormal. And they remove polyps using this technique as well. And oftentimes, colon cancer does start off as these polyps, so that's pretty important.
So if you go in for a colonoscopy, at that same time, if there's a polyp, you can get that removed right then and there during that visit?
Oh, yes. Oh, yes.
And is that a common occurrence?
It's common. In fact, if you know someone who's had a colonoscopy, chances they've had a polyp or two removed.
All right. And what is the treatment if you are diagnosed with colon cancer? Obviously, I'm assuming you want it diagnosed as soon as you possibly can.
Yes.
But what is the typical treatment?
Well, the treatment is the same as any other cancer. If it's localized, we could do surgery, or if it's not, we could even do radiation and chemotherapy. And then there's a new treatment as well called immunotherapy, which is still being developed.
What is that?
It's where we make the immune system attack the cancer cells by buffering it.
Interesting. This new technology and new science being discovered every day.
Oh, which way
So it's not just chemo and radiation now.
Yes.
There's other ways.
There's other ways.
All right. So again, if you don't have a family history, don't fall in one of those groups, probably around 50, get your first colonoscopy.
Yes.
All right. Thank you so much, Dr.
All right. Thank you.
Viegas.
Thank you for having me.
All right. If you want to get in contact with him or anybody over there at CHI St. Vincent Primary Care over on North University Suite 1 here in Little Rock, the phone number is area code 501-552-7900. 552-7900. Thanks again for coming on the show.